Today we're going to talk about ACL tears. The anterior cruciate ligament, or the ACL, is one of the four main ligaments of the knee that connects the femur and the tibia together. It is a strong ligament that allows us to pivot, twist, or turn without the main bones of the leg separating or the tibia sliding around too much. However, the ACL is the most frequently injured ligament of the knee, and studies show that in the United States, 1 in every 3,500 people will damage their ACL. These injuries are most prevalent in athletes who play agility sports such as basketball, football, volleyball, or soccer. ACL tears are also 3.5 times more common in females, and research has shown that this gender discrepancy is possibly due to differences in physical conditioning, muscular strength, neuromuscular control, and/or biomechanics related to landing techniques. So the ACL originates on the posterolateral aspect of the femur and runs inferiorly, anteriorly, and medially to attach on the intercondylar eminence on the tibia. It is primarily taught in knee extension and lacks in knee flexion. The ACL also serves to provide stability during leg movements by resisting tibial motions. This includes anterior translation of the tibia, varus and valgus stresses, as well as internal and external rotation. The mechanism of injury for an ACL tear usually falls into two main categories of injury types. This includes contact or non-contact injuries. Contact injuries are less common and include a direct contact or collision that causes a hyperextension or valgus force to the knee, such as a football tackle. The other category, non-contact injuries, are more common, accounting for about 70% of all ACL injuries. Examples include changing direction rapidly, stopping suddenly, slowing down while running, or landing from a jump incorrectly. These movements can all cause excessive strain on the ACL and possibly lead to a tear. Some signs and symptoms of an ACL tear include a noise like a pop upon injury, pain and discomfort with walking or bending, instability in the knee, including knee buckling or giving way, swelling in the knee, and loss of full range of motion, as well as tenderness at the tibiofemoral joint line. So after tearing your ACL, how do you know if you need surgery? Surgery is the gold standard for ACL reconstruction. However, surgery is not always indicated for nor desired by everyone who tears their ACL. In some cases, it is possible to go without surgery by following a rehabilitation program and avoiding activities that require cutting and/or pivoting movements. Those who are the best candidates for surgery include those who have recurring episodes of the knee giving way, concomitant damage to other tissues, including chondral defects, meniscal tears, or injuries to other ligaments of the knee, such as the LCL, MCL, or PCL, or any combination of these. Now for just a brief overview of the different surgical options. In ACL reconstruction surgery, a graft is used to replace the torn ligament. This graft may be an autograft, which is taken from the individual patient, or an allograft, which is a graft taken from a cadaver. In terms of an autograft, this may be taken from either the hamstring tendon, patella tendon, or quadriceps tendon. And for the hamstring tendon, advantages include a smaller incision, and hamstring grafts have been associated with better extension and lower incidence of post-surgical arthritis. Disadvantages include up to a 20% reduction in hamstring strength after surgery and potential for nerve injuries during surgery. For a bone patellar tendon bone graft, advantages include a lower re-tear rate and better knee stability. Disadvantages include a higher incidence of anterior knee pain and pain with kneeling, as well as an increased risk of post-operative complications such as late patella fracture or patella tendon rupture, as well as patellar tendinitis. Finally, the quadriceps tendon. This type of graft has gained popularity recently and has many advantages over the other types. Some advantages include that histologically it has 20% more collagen fibrils per cross-sectional area than the patellar tendon, which makes it thicker, stronger, and more resistant to rupture than other graft types. There's less anterior knee pain and chance of patellar tendinitis than the patellar tendon bone graft, and better flexor strength than the hamstring tendon. There's also minimal quadriceps inhibition after a quadriceps harvest, and there's quicker return to sport activities with aggressive rehab. Some disadvantages have not really been found yet because it's new, but overall studies have shown low rates of complications and more comorbidities. So So for an allograft, which is a graft from a cadaver and may come from the patellar, Achilles, or tibial tendons, advantages are that there are no donor site morbidity, a shorter surgical time, and it ensures adequate graft length and diameter based on the patient. Disadvantages, though, include a higher failure rate and potential for disease transmission and a higher infection rate, a higher cost, and some studies found impairments in knee stability post-surgery. By participating in physical therapy prior to surgery, it can help optimize outcomes after surgery. One study found that patients participating in extended preoperative rehabilitation compared to patients who did not undergo prehab demonstrated significantly more patients returning to pre-injury sports. That was 72% compared to 63%. So physical therapy before ACL reconstruction surgery includes restoration of normal knee range of motion, reducing knee effusion, and maximizing knee strength and neuromuscular training. This helps optimize results post-surgery. So now for the role of physical therapy after surgery. Although different surgeons and surgical approaches will have slightly different protocols, the goal for all forms of post-op ACL rehab is the same: to return the patient to a normal and complete level of function in as short of amount of time period possible without compromising the integrity of the surgically reconstructed knee. There are 5 primary phases to post-op ACL rehab, each with their own functional goals and areas of emphasis. So phase 1 begins the day of surgery and lasts the first few weeks after surgery. Knee joint effusion, limited range of motion, and decreased quadricep strength in the injured leg are common impairments initially after an ACL surgery. So the goals of PT during this time are management of pain and swelling, gaining back full knee extension range of motion, beginning to restore voluntary activation and control of the quadriceps muscle group, focusing on patellar mobility for proper biomechanical movement patterns, and restoring normal independent walking patterns. Phase 2 goals are to restore knee flexion, incorporate strength training and muscle hypertrophy, and this may include using tools like blood flow restriction to build strength with minimal loading of the healing tissues. Another goal of this phase is to restore functional movement patterns like squatting and lunging to create a solid foundation and reduce risk of re-injury. Phase 3 adds perturbation training to improve reactive balance control and stability. Agility and plyometrics are important during this phase once initial strength and stability has been established to work towards returning to sports and more dynamic movements. Phase 4. This phase focuses on returning the individuals to sports with the goal of preparing the patient for sport-specific movement and functional patterns. This will include return to sport testing to ensure that there's minimal risk involved and the individual is fully prepared to return their previous activities. Phase 5, injury prevention, so you continue with balance and agility training and you advance the sport-specific training. So, contrastingly, there are individuals who may not benefit as much from ACL reconstructive surgery after a tear and may be able to heal with a good rehab program. So the University of Delaware created an algorithm to identify ACL deficient copers, or people who can cope without ACL reconstruction surgery after an ACL tear because they have better knee stability post-injury. It was found that 76% of copers can return to a pre-injury level when they met the following criteria. This includes no more than 1 episode of the knee giving way since the injury, a hop test index of 80% or more on a 6-meter hop test when compared to the non-injured leg, a global rating of knee function of 60 or greater, a rating of 80% or greater on the Knee Injury and Osteoarthritis Outcome Survey, which is an activity of daily living survey. There's also a key point in the study which found that non-copers have shown to be able to become copers with neuromuscular strength training, aka physical therapy, meaning that through physical therapy and proper rehab, individuals who have torn their ACL but don't originally meet this criteria can progress to eventually meet this criteria and thus be able to manage without surgery. It's also worth noting that individuals who are most likely to choose the non-operative route include construction and seasonal workers, athletes who need to compete to retain their scholarship, athletes preparing for a major competition, or recreational athletes who just may decide to alter their activity level. However, there's also increased risks associated with not having surgery, including possible meniscal tears or joint arthroses. So in terms of the role of physical therapy for an ACL tear when surgery is not implicated or chosen, Similar to post-surgery rehab, there are a few different phases that we follow. The initial phase includes finding ways to manage the pain, restore range of motion, and restore strength to create a solid foundation from which to build. The second phase begins to incorporate perturbation and agility training, and a study by Fitzgerald et al. Found that perturbation training programs reduce risk of continued episodes of giving way during athletic participation and allows patients to maintain their functional status for longer periods. Then finally, rehabilitation shifts towards sport-specific training and testing to ensure that the patient is properly prepared to safely return to sport. So, it is very important to find a physical therapist who is knowledgeable in ACL tears and proper rehabilitation protocols, like the many physical therapists at Orange County Physical Therapy. So here are some reference sources, and thanks for watching.